All right, so we will get started. And just know if you have some questions, please use the chat feature, and we will do what we can to make sure that we're answering them as we move through this presentation. But welcome, everybody. We're excited to have you here today. Let's talk about KPIs. I'm sure a lot of you have heard the acronym KPI. What it is, and you've probably heard this too, it's a key performance indicator. Now, there is a distinct difference between a key performance indicator and a metric. A metric provides quantitative data that enables organizations to assess performance and make informed decisions. Basically, metrics identify strengths and weaknesses, along with having targeted improvements in the practice efficiency and also patient care. But in turn, KPIs are indicators that, are more specific, that gives us more measurable value to indicate critical business objectives. We're going to talk a little bit about how we look at those numbers as we move forward with this. But unlike general metrics, KPIs more focus on performance drivers that have more of a significant impact on strategic goals. So as we look at this, what I want you to start thinking about, which is why I asked the question, what are some things you want to get out of this? Some of the key performance indicators that you feel are going to be impactful on the overall productivity of your practice. And we'll get into the details of that as we move along. So why does a KPI matter? Now, there are three different types of people out there who look at numbers. The first person is the person who knows how to get and present meaningful data. Okay, so here's the spreadsheet. Oh, case acceptance is 52%. Is that good or bad? I don't know. And how do I determine what's good and bad? It's, having seeing the number, but really not really the distinct idea of what that means. And I'm not just talking about the doctor and the practice owner and the practice manager. I'm talking about the entire team. Having a full understanding of why are we actually looking at numbers? And I've heard from a lot of you in the 20 years I've been a dental consultant, my team hates talking about numbers. I don't want to talk about numbers. I don't know if I should be that transparent. And as a business, the transparency that you have with your team help drive those numbers. So, it's good to look at it, but now let's get into the second type of person who looks at data. The person who knows how to analyze and interpret the data. So if I get the data, thanks so much, CJ, for giving me this data. I can see we're actually hitting our production numbers. We must be keeping the schedule filled productively. That's it. And so we know what it means when we see that we're hitting our production goals. And that's pretty much it. And then the third type of person is the person who understands one and two, but then does something about it. So, and that's really, I've always been a person who loves looking at numbers. I'm a spreadsheet queen. Love my analytics, because if I look at a number, there is something that we could do about the number. So in any business, these are the people who make the greatest impact. So I could see, from this data set from our hygiene department, we could see how our hygienists are becoming more productive. That being said, it looks like they've implemented the periodontal protocol that we implemented into the practice. There's been a decrease in cancellations in hygiene, which also helped increase our patient retention. Okay, so also by seeing that we're implementing this strategy, it's also affecting how our patients are accepting treatment out of the hygiene chair into the doctor's chair. So that's one strategy that actually affects 5 other strategies that affect a number. So these are things that you're thinking through as you're looking at these numbers and understanding that why. And once you understand and you know that why, this is what you're communicating with your team in terms of why do I need to understand the perio percentage number? Here, I'll give you a really good reason why. I'll actually give you 4 reasons why. of why that's so significant. And the other piece to this too is looking at what is a leading versus a lagging indicator. If we're only focused on things like production and collections, those are lagging indicators. Those happen after the fact. But a leading indicator is patient retention. It's periodontal percentage, it's case acceptance percentage. Those are the things that are actually going to get us to, and somebody said it earlier, it's going to help us have a more effective and efficient run schedule. It's going to help increase overall production and collections. Okay, so these are the things to think about as we look at numbers. So when we see essential KPIs that drive production and profitability, these are things like production versus collections. And again, those are lagging indicators, but you still want to look at that because we want to understand on a month-to-month basis and a year-to-year basis, how are we doing? And every time I work with a client and I'm looking at their numbers, guess what? I look at their history. What did you do over the last 2 to 3 years? And what do I need to set your goals at for the upcoming year so that you're having sustainable growth? And then let's reverse engineer. Now that we know the number and how many days you're working, what do we need to achieve on a monthly and weekly and daily basis to get us there? Provider production per hour and per day, looking at, how effective and efficient are all of our providers. When you have a new associate that's coming straight out of school, or you're a new doctor coming out of school, you should start seeing a trend increasing in terms of your day-to-day production. If you're doing more comprehensive dentistry and you're historically only doing $400 an hour, you might start challenging yourself. And we're going to talk about the benchmarks in a little bit that is going to help you get to increasing that overall number, which at the end of the day, we don't want to have 20 patients coming in and out of chair just because they can. We want comprehensive patients that understand the dentistry that you want to do and that you're making it productive for you. So take away the emergence and look at the more long-term, patients that you want in your office. When we look at case acceptance, what's presented versus what's accepted versus what's scheduled. Okay, so we know what we present. Accepted means that they said yes, and then schedule means they're on the schedule to go. Okay, I talked a little bit about hygiene productivity, and we're going to go a little bit more into detail on that. AR, again, this is one of those data inputs to look at how good are we at not just maintaining the lowest AR possible, because when I see that and it's not equal or 1.5 times your average monthly production, my question to any of you, if I looked at that number, would be, are you providing enough payment opportunities for your patients to say yes? So when you start looking at those things, you want to start asking these questions of your team and yourselves of how do we want to accommodate the patient for the type of treatment that we do in our office. And if we start seeing the AR increasing, again, I don't hit the panic button with any client when I look at the numbers saying, oh my God, you have $25,000 sitting in your over 90. But if I know you're doing ortho in your practice and you're doing extended payment plans on ortho, great, let's back that out and see, is that true over 90 AR? Is anything needing to go to a collections process? And then new patient flow and retention. I know new patients is always one of those areas that everybody tries to work on. And part of the new patients is not just getting in the 20 to 25 per doctor new patients in your practice a month, but also every DO150 that happens, how many of them are reappointing to that next appointment? And that also determines how good are we at our new patient process. Do we overwhelm them, when they walk through the door and they do that 90-minute appointment? Do we, underpromise and overdeliver, the way that we do a new patient appointment? Is the team interacting with that new patient? So again, this goes back to what kind of strategies are we using to reflect these clinical and operational metrics on a day-to-day level. And if we move forward to team performance and behavioral KPIs, how do we get the team involved in this? Scheduling utilization and the percentage of an ideal day achieved. So one of the strategies I use with every practice I work with is a bonus plan. And I don't even like the word bonus, but it's a performance-based incentive plan for the team. Now, those of you who give out Christmas bonuses, that's great. If you just say pull an arbitrary number out of like here's a bonus every quarter, every month, every year. That's one thing. But the incentive plan that is created with the clients that we work with here at the Dawson Academy is more in tune with what they're performing, what we want them to perform to. So in other words, if we look at some of these areas, scheduling utilization and percentage of ideal day achieved. I just had one of my teams send me over their bonus for the month of November. They have 4 KPIs that they are measuring the team against. They hit 2 of the 4, but the fourth one that they didn't hit was how many days did we hit production goal in the month? Well, and I'm going to show you this in a little bit. In the month of November, half their providers were gone half the month for various reasons, whether it was the holiday, they were on a mission trip, what have you. Okay, so then my question was, do we change it from number of days each month, or should we change it to more of a percentage of how many times, or what's the percentage to hit goal each month? Is it 90%? Is it 100%? Is it 110? And that's determined by myself in the practice to see, again, what did we do historically to how do we want to set an attainable goal for the team to help achieve? And the nice part about this, and I'll show you in a little bit when I show you their report, and I'm not naming names, but when I show you their report, it's actually going to show how they've actually increased some of those numbers because they're putting that attention and intention in on it. Same thing with their patient reappointment rates. Same thing with no-shows and cancellations. Okay, doing same-day dentistry is definitely a KPI that you can measure, and also treatment follow-up conversion. This one I actually get a lot of questions about as a consultant. It's really about how should we be doing our follow-up protocol? You know, how best can we track it? How do we make sure that when a patient leaves and they're not sure yet about scheduling that next appointment to say yes to treatment, how do we make sure that we have the right timing, the right verbiage, you know, to actually contact that patient and get them back into the schedule and into the chair? And so these are all things that Dental Intel is able to track as well as myself. So when we talk about benchmarking, benchmarking is basically saying what's the standard. And you know, with the Dawson Academy, and this is only half of them, don't worry, there's more. But you know, we definitely look at, or I've looked at as I've been putting this program together for Dawson, is what kind of benchmarks do we want to set? You know, and what have I seen, you know, and what have we seen as industry standards? So new patient retention. You know, you want to achieve at least 70% of those patients coming back in. And again, I mean, we may think 100% of our patients schedule right after they leave the office. But again, are they scheduling and keeping the appointment? So think about those things as well. Are they canceling? If we look at the schedule, here's a specific one. Cancellations and no-shows should be less than 5% of the total amount of appointments that you have. So here's some easy math. Or I'm not going to do math, trust me. But if you have 300 appointments and you have 50 or let's call it 75%, 75 of them cancel, that's more than 5%. Okay, hopefully, because I'm not pulling my calculator out today. But what you want to make sure is that you are actually looking at that percentage on a month-to-month basis to then say, not to the team in a huddle, oh my God, we're so horrible. We have 15% cancellations. What are you guys not doing? It's going to be more so, let's talk about a few strategies to make sure that our patients aren't canceling and no showing on us. And again, this isn't a I got you to the front office by any means, so never treat it that way. But now it's a team effort because cancellations are affected by every member of the team. They're affected by the front office in terms of how they answer that phone when the patient calls and says, I have to cancel my appointment today. And if they're just saying, oh, okay, no problem, let's go ahead and reschedule you. We've already trained the patient that you do this all the time. If the back office isn't reinforcing the importance of the appointment for clinical reasons, the patient goes and schedules the appointment, but really doesn't find the significance of it, especially if it doesn't hurt. So think about those things. And then now we work on verbal skills as a team to really fully get everybody on board with how we want to address those things. Hygiene pre-appoint. This means our patient retention. So how good are we retaining our hygiene patients to that next appointment? And again, this is a front office, back office strategy to make sure that if our patients, now there's hygiene appoint, and then there's hygiene pre-appoint, and then there's pre-appoint. Sorry, I had to think about this in my head. Pre-appoint means we're walking our patients out with an appointment, which should be 98% of your patients. The pre-appoint's your retention. So if you start seeing that number drop, yes, hygienists will argue with you all day. Yes, I schedule every single hygiene appointment when they walk out of my operatory. But then what happens? That patient walks out the door and then something else becomes a priority. They're not going to keep the appointment. Okay. This again, we don't point the finger at the front office. We look at what are our verbal skills to the importance of that hygiene visit before they leave. Hygiene department. So this is a breakdown between what percentage should our hygiene department's numbers look like. In other words, I'll give you a quick example. I was on with one of my clients a week ago. We were talking about a hygienist who was contemplating leaving the practice. And one of the reasons why she was leaving the practice is because she wanted a very significant raise. And when I started going into their numbers and their software, I actually pulled up the last 10 months, which was January through the end of October, the end of October. And when I did a view of her hygiene procedures, she did 2 SRPs the entire year. So my question to this dentist was, if you keep her, one thing is you need to start holding the standard of what kind of hygienist do you want or out of her. Or if you're going to look for another hygienist, you need to set the standards and the expectation in her job description and her scorecard that we are a complete care practice and that she needs to make sure that she's having those conversations about periodontal need. Okay, so that's a breakdown, and we could break this down in dental intel numbers. You could break this down in your software itself as well. And then treatment planning. I'm not going to go into depth on this because there's so many aspects of treatment planning and case acceptance. And it definitely depends, and I'm going to use the consulting answer, it depends on, how your practice presents treatment. In other words, the type of treatment you're presenting. If you're presenting, dentistry, bread and butter dentistry like crowns and fillings, typically your case acceptance is going to be in the 80s or higher. If you're presenting cosmetic dentistry and large procedures, your treatment plan your treatment plan is going to be really high, but your case acceptance percentage is going to be much lower. And I know some of you are thinking, oh my God, it's 35%, I failed. You didn't fail. It just means, are we getting cases closed appropriately the way we need to? And CJ will get a little into that as well.
All right, so I want to share my screen and go over some of the KPIs that Rachel discussed and how dental intelligence makes it easier for you to track that information. So just want to make sure my screen sharing. With
Yep.
this, so the way dental intelligence works is it sits on top of your practice management software. So we work with Dentrix, Eaglesoft, and Open Dental. The reason why a lot of practices struggle with KPIs is the practice management systems themselves haven't made it easy for you to get reports and then cross-reference that with other data points. So a lot of practices don't do it. There's a lot of great reporting in those softwares. When I go over this, I work with a lot of consultants across the country, and I have one in particular that makes their team pull all these data points from the practice management system, cross-reference that, put that in Excel, and then they get their numbers. And unlike the Dawson Academy that says, hey, use dental intelligence, make your life easier, I do demos not from a referral from them with these practices, and 100% of them sign up. They're like, I spend so much time doing this, I'd rather use dental intelligence software. So to some of those key points, hygiene pre-appointment percentage, case acceptance, perio percentage, case dollars presented, new patient retention, and cancellations and no-shows. So within dental intelligence, Intelligence, we look at these numbers. So, like Rachel mentioned, hygiene pre-appointment percentage. How many of your patients are scheduled for their next hygiene visit within your practice? So, this is a total number. 71% of this office that I'm showing you has their next hygiene visit scheduled. Then we also have a pre-appointment percentage. What percentage of the total patient base is scheduled for some kind of treatment? Um, then we also look at the no-shows and cancellations. We broadcast that. And so we're looking at this on a weekly basis. So this practice had a 4% cancellation rate so far this week, and they have not had a no-show yet. Now, some of you might be looking at this and saying, hey, what's hygiene reappointment if we already looked at hygiene pre-appointment? Hygiene pre-appointment means that patient has their next hygiene visit scheduled. Hygiene pre-appointment means they came in for treatment today and they left today with their next visit scheduled. This is one of those leading indicators where you're preparing to make sure that you have future production. So when we look at hygiene pre-appointment percentage, Rachel mentioned, if we have practices, and I've talked to thousands of practices over my career, there's some that say, hey, it doesn't matter. You get that patient scheduled for the next hygiene visit, whether it's just like, oh, it's just tentative, we'll get it scheduled. Those are the patients that are going to cancel their appointment because it's a loose cancellation or a loose scheduled appointment, where it's more important to have something where you have upwards of 90% of firm appointments scheduled that the patient is expecting, they're expecting to come back in 6 months. And so looking on these, when you don't have a patient scheduled, the way that Dental Intelligence makes this easy is this practice can then go after these two patients and get them scheduled for their next visit. Moving on to case acceptance and perio. So within our dashboards, we have a provider pulse dashboard. So tracking, especially if you have associate dentists, you want to see how they're performing. You want to look at hygienists, how they're performing compared to their peers. Or do we have a low case acceptance? Do we have high case acceptance? Do we have low patient presentation, so we're not even presenting the treatment? So if I look on here on my list of from her previous slide, hygiene, or sorry, case dollars presented. So if we look at case acceptance and same day treatment acceptance, we can look at this and we can look at it on a daily, monthly, weekly view. If I go to a monthly view and look at November for this practice, we'll see that there was a total of 31 percent treatment acceptance. Here's how much was presented and here's how much was accepted. Okay, and it breaks it down by provider so you can have conversations with your team about, hey, how do I get you to 58% when you're only at 36% and this provider is at 58%. In hygiene, periodiagnostic percentage. Sorry, is this, yeah, perio percentage. So periodiagnostic percentage, how many cases were presented with periodontal disease, and then we also have the periodontal acceptance percentage. New patients, I want to go back to this. Some of these KPIs, new patients, I want to look at this on this weekly basis. Tracking the new patients that come into your practice and how many of them leave with their next appointment is really important, but it's also important to track how many patients your practice lost out the back door. And if we look at this, 9 out of 10 practices can tell me how many new patients they got this week, how many new patients they got this month, but very few can tell me how many patients did we get reappointed that weren't coming back to the practice, or how many patients did I lose due to inactivity. So when I click on this, there's 5 new patients that came into this office last week or this week so far. They lost 2 patients. 2 patients, how do we consider those lost? One of 2 criteria. Either they were marked inactive by the practice, which is totally fine, or they hit the 18-month mark. I'm trying to delete my email that filled this in here. Without a visit. So a lot of times we have patient retention issues because they slipped through the cracks. This keeps it in the forefront for your team to make sure that not only are we targeting new patients, but we're making sure that those patients stay with the practice.
Yeah, and if
Is
you're
there anything else you
looking,
wanted me to cover?
no, that's great. Thank you. And when we're looking at, things like retention, It's always so easy for us to say we need new patients. And we know the cost of bringing in a new patient and, how long it actually takes. And I've done dental marketing for years, but one of the things I warn everybody about with new patients is it's not quantity, it's quality of those new patients. It's how we bring them in. It's how our office is operating and setting up. It's how our team engages with them. And, it's about asking for things like referrals, the cheapest, quickest, and easiest way to do it. But, and I am going to use a but here instead of an and, but it takes 6 to 9 months of effort to actually see a new patient growth. But wouldn't it be great if it was just easier to say, hey, we had patients that fell through the back door. I have a
Mhm.
practice with 694 patients that are not active. Guess what? They're calling them. And when their hygienists have an open hour, I don't want them sitting and sharpening instruments and making the hygiene goodie bags. I want them calling 5 to 10 of those patients in that hour to make a productive, informative, and urgent call that, hey, you fell out of our hygiene cycle. We need you back in order to keep you healthy. Let's set an appointment.
Yeah. I want to add on to that real quick. When you look at patients that are inactive, so there's two types. There's the inactive that are marked inactive, they're gone. Then there's inactive due to inactivity. And so the way dental intelligence tracks this is we say, has this patient been in the last 18 months? If not, as a statistical data point, we're going to say that they're inactive. They're still marked active in your practice management software, but then we can easily look at and say, how much is my average patient worth to me every single year? Then we go in and we say, all right, how many patients do I have that are not scheduled to come back in? And this practice, there's 1,200. So that's $1.2 million in opportunity cost that's sitting out there, and it's easier to tap into than if you were to go market and spend thousands of dollars a month attracting new patients that then you have to convert into a patient that stays with you for years versus somebody that's come in for years and then just happened to slip through the cracks and didn't schedule their next visit.
Yeah, I think this is probably the most critical metric of all, especially for those of you who bought practices from previous owners and inherited the patient base, especially. I actually have 3, 4 practices right now that I can think of that I work with where they're telling me the schedule's light. We're not being as productive, and I probably gave them about 10 different strategies to go tap into that database of patients. And my first question was, when's the last time they've had a comprehensive appointment? So again, if we're PPO, we know that there's time and waiting periods for it. But at the end of the day, if they haven't been in for a comp visit in 3 to 5 years, depending on where you're located, they should be coming in for a comp visit. Not only that, if they've never seen you, then you're introducing something completely different than the previous dentist probably did.
Mhm.
And that's really the key, is getting back to those patients. So it's great to have lists. Let me start with that. But those lists have to have some sort of value and intention to them. And I can't tell you how many times I get oh my God, I called 50 patients today. I don't want to hear that ever from a practice. I want them to tell me, I called these 10 patients. Out of the 10 patients, I actually got in touch with 3 of them who scheduled their next visit because they haven't been in 18 months. So it's chipping away. I'm going to use the analogy, how do you eat an elephant? It's one bite at a time. You never, just take a list of 150 people and just do a call blitz. It's more of, let's look at some of these patients, and we start with the patients who are most recently marked inactive, and then you start moving backwards. And then you could really truly inactivate, or move them out of your database in some capacity, so you're not going after them again. And it's way better than having a spreadsheet that gets lost in the mix. People touch it, things get lost, data gets misinterpreted. So having something sustainable that we're utilizing that everybody has oversight with, especially you as practice owners, that your team is actually taking involvement with what they do. And when I talk about bonuses, and raises and things like that. And these are questions I get pretty much on a weekly basis by clients. It's the old, I want another $3 more an hour. Well, what makes you think you deserve $3 more an hour? Well, I answered the phone all week. Great. Tell me how that's different from what's already in your job description. Like, what's it actually affecting?
Yeah.
And once you start having those types of conversations, and I'm not telling you to say that to your team member, but think about it. When you start having those types of conversations with your team members of what you expect, and I'm going to help you, get that extra $3 an hour, or we're going to bonus you, or we're going to do, whatever that's going to take. But I'm going to need you to contribute to those numbers in a different way. And
I want to
here's,
address, oh,
go ahead.
sorry, go
No,
ahead.
keep going. Go ahead.
So I wanted to address really quick. John Jackson and also James Tong mentioned scheduling and production. So more efficient scheduling, efficient production. When Rachel mentioned that instead of having a hygienist sit around sharpening tools, making the hygiene goodie bags, let's have them be productive and get patients back onto their calendar. If you just give that task to a hygienist, they're going to go to an unscheduled hygiene patient list and they're going to work their way down. It's more efficient to schedule those patients if they're unscheduled for hygiene and they have outstanding treatment. So with dental intelligence, we can go in and we can create these custom lists for them to target to be as efficient as possible to make sure that you're not only bringing in hygiene patients, but you're bringing in hygiene patients that can convert easily into your ops and complete their treatment that's been outstanding for 6, 12, 18 months for sure.
Absolutely. Good add-in. And again, this is, when you look at how much am I paying a hygienist? If I'm paying a hygienist between 40 to some of you are paying 60, $70 an hour, because that's what they're all asking for, and hygienists mysteriously disappeared after 2020. It's how do we make it worth it for you? 65. Okay. How do we, that's why I said 70 plus. How do we make it worth it for you that they're actually producing 3 times what you're paying them at a minimum?
Mhm.
So not just, when I look at schedules and I see prophy, I start asking a lot of questions of what is that periodontal protocol looking like? How is it being presented? How is, what photos, x-rays, what software are you using to present it to a patient? And how comfortable is your hygienist actually having those conversations? And trust me, I've been to a few hundred, if not more, offices where I literally would sit and listen to a hygienist speak to a patient. And there have been, I won't say a 9 times out of 10, but there has definitely been opportunities that I've found through hygiene departments of, are they spending, 80% of their time really educating the patient on the dentistry, or are they spending 80% of the time, shooting the breeze about, what's going on in their lives? And this isn't, again, we're not knocking hygienists here, but it's a perfect example of, what we need to start setting as expectations, and this is where the numbers come in. So, and Dr. Reed, thank you so much. I do like that. So, targeting 3 to 3.5 times their hourly rate as a primary daily goal. Perfect. Because then again, it's, if you're paying $60 an hour times three, it's $180 an hour. What is that exactly? And whether you're doing write-offs or not. So, CJ, thanks for the dental
Yeah.
intel insight.
And,
So
and we're
we're
going to
gonna,
come back and we're going to show another thing called the morning huddle shortly. Do you want me to explain this slide?
yes, please.
So, dental intelligence, we work with around 15,000 practices nationwide. So, every year we gather data points from across all 15,000. So, it's not every dentist in the country. A lot of practices with dental intelligence, you have those that are active users that log in every day, that have their teams on board, they have their goals, they know the why. Um, they use dental intelligence and they're very efficient. And that will give you your top 10% as far as production numbers. So if you want to take a screenshot of this, feel free to. We produce this report every end of January, first part of February for practices to see where they compare against other practices in the industry. And so these are the benchmarks from over 15,000 practices for 2023 and 2024. So you can see if you're running reports in your system, how do you compare against Dental Intelligence's customers.
Absolutely. And I know a lot of you are competitive. So this is a good metric or measurement to see how competitive you are with other dentists that you're trying to meet to. Um, Okay, so what if I don't know where to start? So CJ ran through some of these metrics already. So that hygiene pre-appoint, these I would say are the top six metrics to look at in a practice and to start measuring against. And again, when we start thinking about things like how do I hold my team accountable to these things, this is where that number comes in. It's not so much throwing the number down their throat, every single day. It's going to be about on a monthly basis when you're having that team meeting. What are you actually communicating in that team meeting and understanding, what do we need to do to actually get there? I had a practice a few years back that I used to work with, and we were tracking their retention number, which is hygiene pre-appoint. And we actually gave the team a 90-day runway to get the number to increase by 3%. And that number is a slow number to increase because we're looking at how many patients aren't scheduled and getting them back on the schedule. So there's always patients that might be falling off. So it's an effort that everybody has to make. And by the end of the 90 days, and if they hit that 90-day, there was a reward for the entire team. They just made it by 0.2%. So within that 90 days, but they were hitting on those strategies every single day to actually help that increase. And then over time, it started to increase even further. So when we're setting measurable goals, the measurable goals have to align with your vision. And those of you who have been on my webinars in the past, I speak about vision on a constant basis because the vision is the destination of where you want to be in the next 12 months. And if you don't have a clearly defined vision that your team is aligned with, it's going to be harder for them to buy in to what you're trying to get to in your practice on a day-to-day level. It's going to, be difficult to empower them to hit these production goals that you're looking to achieve, again, to sustain the, profitability of your business. And part of this, when we look at it, again, I know it's difficult to talk to team members about numbers. We do it here at the Dawson Academy because we are also a business. I'm sure Dental Intelligence, they do the same thing. It's an awareness that we all have to have because I'm just going to assume that everybody likes getting a paycheck, that we like getting the supplies that we like the labs that we use, we like to keep the lights on. And what they do is contributing to those things. So, but we're not going to get there if we don't have a clear vision in mind and that your team is bought into it as well. And so when we look at the goals, it's, what goals do we have for each individual within the practice? And I'm going to let CJ take the lead on the morning huddle component in a minute. But provider goals, as providers, as dentists and hygienists, do we know what our scheduling targets are? Do we know what our case acceptance goals are on a month-to-month basis, if not a week-to-week? Hygiene goals, same thing. Do we know pre-appoint, perio, daily production? As an admin team, are we hitting on things like collections, accounts receivable, and efficiently scheduling the day-to-day? And as we're creating this visibility, that's where scorecards, dashboards, and the huddles, daily and weekly meetings, really come into play to make sure that everybody is taking part in it. It shouldn't overwhelm the team on what it is, because really, if they're coming in prepared every single day, by talking about the daily metrics, by understanding what those weekly metrics need to be, by, embracing those monthly metrics and how we've been doing, these are opportunities for every single one of them to not just be a dental assistant, and not just be a hygienist. It's how are you contributing as the CEO of your chair to, get our practice at next level? And not only that, I mean, again, at the end of the day, what we really want, if anything, is that our patients have the best possible outcome. And if our patients are writing Google reviews and doing testimonials and referring other patients to you, you know you've won the game. Therefore, all these other things become very organic. And I always use my dentist as my prime example. My clients probably hate when I say this, but they truly are. Everything from how they subliminally market, the procedures in their practice, to the way that everybody operates, in such an efficient manner, from the scheduling team all the way back into the back office. It really does drive, their success on how they operate. And I'll tell you, I've referred dozens of patients to them who've done everything from, like, I just go in for my pro fee to $30,000 in treatment. And there's a reason why they're going there and sticking with that. And guess what? Those people that I referred are referring other people. And that's called that natural growth. So we want to make sure that we're looking at those opportunities in the best possible way. So CJ, I'm going to have you go ahead and share Morning Huddle with
Okay.
everybody, because it's Morning Huddle is probably my favorite feature of Dental Intel, and it's the one feature that I actually work with each practice to master as a team. And when I say master, I want them teaching me how they're using this Morning Huddle component, because this is driving those KPIs that I'm giving them to work through on a day-to-day level. So I'll let CJ go with this.
I agree with you. It's one of my favorite features. Whether a practice sits down and has a formal morning huddle or not, it gives the team members a consensus of what they should be talking about and who they should be talking to and why. So they understand the vision of the practice is we're not just checking in patients and letting them sit there. If they have outstanding treatment, we need to be discussing options, bringing it up, offering if we have availability in the doctor's chair and they're in for hygiene to get those patients scheduled for same day treatment. So I have this practice that I've been showing you is an active dental intelligence user. We have a HIPAA filter turned on to blur out the information, but yesterday, they had 30 patients on the schedule, three new patients. They did 21,000 in production. They beat their goal by $6,300. It's not always the case. This happens to be a great day for them. Some days they're a little bit below. When I show you the today's view, where do they compare in comparison to their goal for that day? Five of their 30 patients are never scheduled to come back. So, in most practices, this is where patients will start to slip through the cracks because there's not a system in place to make sure that they are reached out to. So, I can see exactly who they were. So, they beat their goal by $6,300 and four patients missed their appointment. So, it is an outstanding day because you drop in production by missed appointments, but they also made it up with same day dentistry. And I'll show you how they do that. And then one existing patient came in, was treated, and left, and they don't even have their next hygiene visit scheduled. So you'll see that on a daily basis along with all your daily production numbers. When we look at the today's view, this is where the magic really happens and how we increase in production every single day. You look at this, there's 39 patients that were on the schedule today, 22,000 in production. They're projected $2,500 above goal. When I look at this, I say, okay, 39 patients, let's pretend that they were below goal by $2,500. How do I address this? I look at these 26 patients that are coming in that have $105,000 in outstanding treatment. I click on it and I view exactly who they're coming in to see because we coordinate these with doctors and hygienists. Orange are doctor's visits, purple are hygiene. So if I have a patient coming in for hygiene that has $2,500 in outstanding treatment, I can click on this and easily see what treatment that is. And if my doctor has open chair time and I'm not even proposing this treatment that was diagnosed that's outstanding, I miss an opportunity. That patient might not schedule it for today, but it gives them an opportunity to address it and get them on the schedule for future production. That's one
So
huge driving factor for production. Did you have something, Rachel?
yeah, sorry. So
You're
I'm
fine.
going to interject a little bit here too. In Morning Huddle, okay, whether you have dental intelligence or not, right? Morning Huddle should be a very intentional 15 minutes that is getting your day started off on the right foot. And not only that, it shouldn't be the doctor standing in front of the room, in front of a computer screen, saying, "Oh, here's every single patient that's coming in today," and everybody's sitting there with a deer in the headlights look to their face. It really should honestly be every single department and provider in the practice is talking about what their intention is per day. And when I say that, it's not some loose, like meaning. It's if my hygienist has 8 patients coming in, and 4 of those patients have outstanding treatment plans, those are the 4 I want them talking about in that huddle. Those are the ones who I'm going to say, all right, hygienist, what are you going to do to get that patient to accept treatment? And then even the dental assistant should be reporting out who's coming in the doctor's chair. If they
Mhm.
look at the patient chart and they see in the chart audit, this patient still has $4,000 of outstanding treatment and doesn't have their next hygiene visit scheduled. What an awesome opportunity that is to get them on the schedule. So it just drives a different type of meaning to what that morning huddle looks like. And I'll tell you, start having morning huddles like that. And again, this is reinforcing expectation on the team that they're not just there to collect a paycheck. Yeah, and I know it's tough to be tough on them, but I'm going to tell you to be tough on them. But now it's what are you doing to justify the salary I pay you, the raise that you want, the bonus that I'm planning on giving you. That's going to be, it's not an expectation anymore. It's more of this is what you have to do to get there. Sorry, go ahead, CJ.
Absolutely. And so, as she was mentioning, it becomes everybody's responsibility because this hygienist clicks on their schedule for the day, they can easily see that unscheduled treatment. So it's not only the front desk responsibility, the hygienist can reinforce the need for the treatment when they're sitting chairside if they have this information in front of them. Dental intelligence provides actionable insights. A lot of the suggestions was scheduling and efficiently scheduling. When we view schedules by operatory and we have gaps, and you can also view this on a provider basis, if we have a gap and we've exhausted all of our ASAP list, unscheduled treatment lists that you have on a sticky note, dental intelligence provides the ability for me to come in here and say, I don't want my hygienist sitting around for 3 hours at the end of the day. Let's try to fill that vacancy. Let's pretend this is a hygiene operatory. It'll ask me to choose which hygienist I'm looking to fill that for. And let's say this hygienist is the one that doesn't have patients. We click on that hygienist name. Dental Intelligence will go through the practice management software database and it'll cross-reference patients with the highest reimbursement rates with insurances, patients with the lowest AR balances, so we know we're not going to do treatment and not get paid for it, patients that show up on time, patients that typically accept treatment, and then we also look at, because this is hygienists, unscheduled hygiene that are past due. And then we're going to stack rank those patients across all those criteria to give your team an accurate list of the best possible patients for them to start calling. And then they can work their way down this list. As you go down, less and less of those criteria are met. So our match confidence level decreases. When we look at conversations to have, unscheduled hygiene, 39 patients coming in, 9 of them don't have their next hygiene visit scheduled. One of the easiest conversations. Don't wait till they check out. When they're checking in, have that conversation with them. When they're in the chair with the provider, let's get your next hygiene visit scheduled. I don't want to take too much more time on Morning Huddle. The tomorrow's view is the same as today's view, and then we also look at the total for the week every single Monday in this view. So I want to save some time for question and answer. So I'm just going to pause there. Happy to answer any questions after as well. Let me
Perfect.
stop sharing for you. I
Okay.
don't know why it's not letting me
All right.
stop sharing. There we go.
Are you seeing my screen?
Yeah.
Okay, perfect. My internet's a little wonky right now. Okay, so as we look at data, whether it's dental intel or any other data, it's a daily and weekly conversation. It's how we operationalize the numbers. What are the numbers we are putting our attention to? In the daily huddle, how do we highlight those openings, the opportunities, the same day dentistry if we have the opportunity to do it? In a weekly meeting, and I recommend weekly meetings. I mean, if it's every 2 weeks, it's fine, but at least a couple of times a month at a minimum that you're having a meeting, whether it's training or the business itself. How are we reviewing the KPIs, the wins, the bottlenecks? I can't tell you how many times I've watched morning huddles that went down the rabbit hole because we talked about something that, somebody brought up, and then all of a sudden 15 minutes go by and we got to get our first patient in the chair. That's called put it in the parking lot. In the parking lot, it goes to the weekly meeting, and that's it. Somebody has to be really good on your team to actually parking lot something, which means you're going to have to interrupt somebody in that meeting, including one of your team members interrupting you, doctors, to stop going down that rabbit hole and then push it to push it to a more, either sidebar or your weekly meeting. Provider check-ins. So again, making sure we're reviewing the production goals on a daily versus what's reality. Do we have a gap to get us up to our goal? And again, one of those metrics I'm measuring with a few of my practices is what's the percentage to get us to the goal? And if I'm going to bonus the team, is 90% appropriate for a tier one goal and we're going to bonus them on it? Or do we put it to 95% as tier one, and then tier two, if we hit 100%, everyone gets a bigger cut of the bonus. Okay. So, and then that monthly deep dive. So actually, I'm going to do a new share right now and give you a little perspective of what the monthly numbers look like. Now, I'm not showing you whose practice this is, but this is showing one of the practices that I'm working with currently. This is their November numbers. So we could see here in the month of November, they're up 12% to prior year, which is pretty awesome because we actually projected a 10% growth for this year. So I'm extremely happy with them. They're pretty happy with themselves. And it's because we have very targeted goals that we're setting for the team. Nothing that's not attainable. They're very realistic because they're based on history. And then when we look at production, and yes, this looks like a very ugly number here, but as you could see, their production average has changed. Why? Because they took time off in August. They took a lot of time off in November. Their main provider, who's doing his $30,000 cases, went on a mission trip. One of their main hygienists was out on a mission trip. So November, and of course there was Thanksgiving, wasn't, as profitable that month, but they're still up in their overall year-to-date production. But as you can see here, one of the nice to haves that we can have is what is that production per visit looking like? And as you can see over the year, it's actually gone on a pretty steady pace where it's also increasing over time. And then we can get into these, other areas of opportunity in terms of like, how are we making sure that our hygiene department is as productive? What are we doing in terms of restorative? This is a practice with a new associate that's still trying to kind of figure out where he's at clinically in the practice. So it's, giving us an idea of how do we build this associate up? And one of the strategies we're using is case conferencing on a weekly basis between him and the owner dentist. And he's bringing in cases that he is treatment planning and going over them with the owner dentist to, actually talk about how he would approach that. And it's actually giving him a lot of training and guidance on how to do it the way that he was taught how to do it. And has, perfected over the last 20 years as a dentist. And it's actually building the confidence level up of his associate. And so over time, I've been seeing his associates' numbers increase in the last year and a half that I've worked with them. And it's a nice add-in to have. Now, again, we go into active patients. We could see in the last month, they had a drop in active patients. They also, inactivated a bunch of patients that no longer come to the practice. They either are not with us anymore or they moved away, and, we could see, again, the number of new patients. These are, this is a metric that we're actually monitoring a little bit more closely. But if I go down to the hygiene pre-appoint, this number was sitting at about, I think it was 73% about 6 months ago. And so with this, it's had a variable increase because guess where we started their bonus system? In August. And so now we could see the numbers starting to bump up because now they're putting more intention on how they're getting those patients to keep their appointments, and how they're speaking to patients about the importance of their appointment in the back office. Not only that, their hygiene reappointment went up as well. So there was a little bit of a drop off. They also had a drop off of a hygienist and had to get a new one. But what, they're putting their attention to is making sure every patient walks out the door with a hygiene appointment. So these are, nice to haves, to actually see this. And on top of it, it's just creating a really good awareness, amongst the team to know exactly what they should be going after in terms of the goals that we have as an office. So again, if we look at these team-based strategies, scheduling efficiency, case acceptance, collections and AR, hygiene, productivity, and patient retention, these are all opportunities for every single practice to utilize as, we're going through that day to day. A couple of you talked about building the ideal template, and I know there was a question in the Q&A before I got logged off of how long, should we be scheduling some of these hygiene appointments? How long should we schedule an SRP? One of the strategies that I get laughed at for, because I really push it more than anything, and it's usually one of the first strategies, is time studies. And how long does it actually take to do those appointments? Even in the hygiene department, I recommend doing a time study, because you have hygienists who could do a 2-quad scaling and root planing in probably 60 to 90 minutes, but you have other hygienists that might take them 2 hours. So you really have to sit and determine how long does it take. In my office with the new associate, his associate might take 3 hours to do a crown prep, where he might take 90 minutes. So we need to determine what that time looks like. And then once you determine that, is where do we place that into the schedule so that not only A, are we scheduling in an efficient manner, but B, we're hitting the production goals that we need to hit in order to get the perfect day in. Okay, so hygiene, to go back to that question in the Q&A, I typically recommend 60 minutes for a prophy, but I've also recommended over time, that you can break down the hygiene appointments to a 30, 40, 50, and 60-minute appointment. 30 is for edentulous patients and kids. 40 minutes may be a patient with some missing teeth. 50 minutes might be a healthy hygiene patient that doesn't need radiographs, and 60 minutes is doing everything, for a patient. And then again, scaling or replanning, it depends on your philosophy of, 1 quad, 2 quads, 4 quads, however you want to run it. But this is where you have to get the input from your hygiene team and your scheduling team to see what is efficient, what's going to work for everybody. And for you as a doctor, if you are one doctor with 2 hygienists, and I know your complaints, I know them because I've heard them for 20 years, or your challenges, I'll call it, not complaints, is that, I'm in the middle of a procedure and I have to go do 2 hygiene checks. Well, if you have a good balance of perio versus prophy in your practice and you have 2 hygienists, then those hygienists should be balancing out in their schedule. One's doing a prophy, one's doing a perio maintenance. Guess what? You only have to go do 1 hygiene check that hour. And then the next hour, you get one hygienist doing another perio maintenance, one doing a prophy. So again, this is about really sitting back and understanding what kind of schedule do you want to run, and how do you want to run yourselves in that schedule so that you're not running around like a chicken with your head cut off. So, that's how you're going to hit these ideal days. This is part of where, some of my clients who are up, 10, 15% in production, they started looking at their schedules in a very different light. And not only are they starting on time, they're ending on time, and they're getting out of the office at 5 o'clock. And if they're thankful for anything, it's that reason. And balancing work and life in there. Case acceptance, what kind of complete treatment plans are we using? What kind of visual aids do we use? How do we follow up? And again, I'm going to really stress on that follow-up attempt. And not only that, even analyzing, and somebody here may have a really awesome spreadsheet, if you're not using analytics, to really determine, in terms of what gets accepted based on value of treatment, understanding that, typically patients who are coming in and they know they're going to be doing big treatment, Case acceptance becomes a little bit higher because they know they're going to spend the money on it. But where we struggle are the patients who are, contemplating doing a treatment that's between $1,000 and $3,000 because it doesn't hurt. So we really need to look at how do we approach those patients at every single turn, because when you're identifying a full mouth case versus a crown or two or a couple of fillings, it becomes a very different conversation that you have to have. And the follow-up attempt is, do you want to schedule your appointment because doctor said that, you need a crown? That's not how we approach it. So what we teach are the verbal skills to help with, following up with that very systematically. We talked a lot about, hygiene, productivity, and reappointment. Collections and AR, if you're not collecting what you're producing, you should be collecting 98% of what you're producing. Then this is where you want to make sure that you have systems in place to ensure that, we're getting money over the counter, that we have the right, third-party financing options in-house membership plans, whatever you're using in your practice, and that everybody is well versed in those opportunities for your patients. I'm not telling you to have dental assistants and hygienists to talk about insurance. It's the last thing I want them to do. But I do want them to understand when you walk out of that room saying, patient, you need a crown, and they turn to the hygienist when you walk out that door, they're going to say, do I really need it? How much is this going to cost me? The hygienist should be versed in the payment opportunities that you have for that patient. And then retention, again, I can't stress retention enough. It's one of those things that, just is so apparent that a lot of people need assistance with. So now where do we create this? Having this unified performance system. So we want to make sure we're clarifying the expectations of the KPI. If we're going to monitor perio percentage acceptance, if we're going to monitor retention, your team has to know why, and how does that affect them as a team and what their expectation is. Setting goals that support the vision. So again, if we need to revamp the vision, oh wait, this is a great time because we're coming to 2026 in 3 weeks. So 2026 would be a great kickoff meeting with the team to say, hey, let's re-examine the vision. And I want you all to come in with a answer to the question of, if we were sitting here 12 months from now, that's January 1 of 2027, what will need to happen in order for us to feel that we've been successful this year? Then get them to contribute what that means so that you can rewrite your new vision to have a destination of where you're going to go in the next 12 months. Then you come up with the goals to support that vision with KPIs. Okay. If you have analytics, if you have dental intel, again, I'm a supporter of dental intel, but I know there's other analytics out there. And, if you don't use it, utilize your software to get you that daily guidance. And then creating the culture of accountability. Okay. I know we're all scared that team members are going to leave. Trust me, I talk about this on a day-to-day basis with all of you. You still have to hold people accountable to the expectation that you have to run the business that you have invested your livelihoods in. So you want to make sure that you're creating that culture and having the meetings and the training to have continuous improvement on that. So as I put up this page, this is an opportunity for you to meet with CJ. If you don't have dental intel or you're interested in it, I know it's EagleSoft, Dentrix, Open Dental, and Fuse. Fuse.
We do Fuse is phasing out. So if you're still on Fuse, we can talk, but EagleSoft, Patterson's phasing out Fuse. So we can talk about it, but we do analytics with Fuse, but it's
Okay.
very rare that practices are still on it. So,
I know. I just have
so
one.
about this offer. So this is an offer for anyone, and I can appreciate you guys spending over an hour on a Wednesday night participating in this. It means that you want to grow your practice. So Dental Intelligence, we put together this offer for the Dawson Academy. Anyone that views this, anyone that was participating, please scan, fill it out. There is no obligation to sign up for our software. If you want, we can do a complimentary sync with your practice information. You'll just let me know when we reach out to schedule this. Or if you book it on my calendar, I will go ahead and make sure that my sync team gets in place. If you want to see your actual numbers, or I can show you dental intelligence using a current customer. But you schedule a demo with me. It's about 45 minutes. I'll answer all of your questions. Rachel loves to participate with those when we get these scheduled with members of the Dawson Academy. We're going to send you a $250 Amazon or Visa gift card. Criteria: owner doctor has to be present. So if you're an associate, bring the owner on. If you own a practice, schedule a time with me. There's no obligation to sign up. Practices utilizing this software do see a tremendous increase. You amplify that with coaching with Rachel, and it really skyrockets. It becomes that much more efficient because she really hones in on the systems behind the data. Um, if you are a current customer and you don't have all of our products, because we do patient communication, online scheduling, insurance verification, e-claims, everything like that. If you're a current customer and you don't have all of our products, we don't have a specific offer for you. But if you schedule with me, I can assure you I will get you something. It will be well worth your time. I can't say it'll be $250. But this offer is good through the 31st of this month. As we prepare for the future in 2026, practices are making goals. We have incredible price savings, even lower than our negotiated Dawson pricing. So definitely a great time to look at this. Schedule a time, meet with me and Rachel, and we'll go over your practice data. So
Perfect. Thank you. And with that being said, if you would like to book a complimentary meeting with myself and talking about your overall practice goals, you can go ahead and click on my QR code and it'll take you to my schedule to schedule some time with me, anywhere between 30 to 60 minutes, and really honing in and identifying some of the pain points that you might be having in your practice, where both myself and Larry Gazzardo, who is also now helping consult to our Dawson clients, are now taking this at next level with anybody who's part of this program. So this will give you an opportunity to understand, ROI around, investing in something where you're partnering with us on the practice management side, to, really identifying, where we can help you. And, this is a very customizable program. This isn't a, you have to do this because because that's what it is. It's more so understanding, where do you have the biggest opportunities in your practice that we can really leverage. And again, we go after things that are going to give us a quick return quicker and faster. And then we start going into the more long-term things as we move forward. So I'd love to sit down with all of you at some point, because again, like CJ said, getting on a webinar like this, and for some of you, it's 8:13 at night, is just a bigger opportunity that that you have to, help your practice move to that next level.